Hi guys, so today I'm going to be talking about something that's really near and dear to my heart. My little brother Justin has a severe allergy to peanuts. So when I was 5 and he was 2, he had his first anaphylactic reaction, and it was because he had consumed peanut butter on accident. Well, we didn't know it was an allergy yet. So when he went into anaphylactic shock, it was a really scary time for me, and I remember it. And I really didn't know a whole lot about the issue. I really didn't know what anaphylaxis was or what the signs were. So today, I'm going to teach you what anaphylaxis is, what the signs are, common allergens, and then how to use an EpiPen. What is anaphylaxis? Anaphylaxis is a severe whole body reaction to a chemical that entered the body that's also an allergen. Anaphylaxis can happen at any time, and it's super life-threatening, and it's just if you get exposed and your body just doesn't know what to do with the allergen in your body. So for my brother, when he touched the peanut butter to his face, when he put it to his lips, he felt a weird tingly situation on his lips. So about 10 minutes later, he was in full anaphylactic shock, and it was really scary to experience and be there for because we didn't know what was going on because this is the first time. So anaphylactic shock can come out of anywhere, and it can be caused by anything. Allergens are super widespread, super common, and just knowing the signs will really help. So when my brother went into anaphylactic shock, his face started to swell and he broke out in hives and he had a really hard time breathing. But that's not even all the symptoms that can happen with anaphylactic shock. So I'm just going to list a few that I know. Abdominal pain, anxiety, chest discomfort or tightness, a cough, diarrhea, difficulty breathing, dizziness, hives, nasal congestion, nausea, skin redness, slurred speech, swelling of the face, eyes, or tongue, unconsciousness, and wheezing. And these symptoms are not always the most evident right away, but usually within about 10 to 15 minutes of being exposed to the allergen, if there's going to be a reaction, it occurs. So knowing these signs will really help anybody that you know with severe allergy in the future. So some common allergens are peanuts, bee stings, dairy, cats and dogs, pollen. There's a lot of allergens out there. Pretty much anything that anyone can be allergic to, there can be an anaphylactic reaction to. So again, in my brother's case, it's peanuts. And I know people that go into anaphylactic shock if they're in the room with citrus or if they're in the room with other nuts or dairy or anything. And it's just an avoidance issue, and just being aware of these allergies will really help these people along. So my little brother has been living with his allergy for about 13, 14 years now, and it's a thing you learn every single day, and you experience a lot of hard times with eating out if someone has an allergy or going outside, but it's something that you have to live with on the daily basis, and not treating the person any different will really help define anything, because it doesn't make them any different. It's just things that they cannot do or be exposed to. When you see the symptoms, you would want to get an EpiPen if they have one. If they do not have an EpiPen, I would suggest calling 911 right away and getting a hold of them, and then they'll send medical attention really fast. So I'm going to show you how to use an EpiPen. Alright, so using an EpiPen, this is an EpiPen. I'm not going to use a real one because that's super dangerous if you do. What will end up happening here if you do give yourself an EpiPen, that when you're not in anaphylactic shock, is your heart rate will go up really far because your body is being exposed to a lot of epinephrine, which is not good for your system if you're not in anaphylactic shock. So this is a trainer, so this does not have the needle in it. Okay, so what you're going to do is you're going to take this, you're going to take off this blue cap right here, take it, and then you're going to stick it in the pant seam of your outer thigh, whichever leg you would like to do, whichever is your preference, and then you push it, wait for the click, and then you count to 10. And it's super important that you wait to count to 10 because you want the injection to be fully in the system before you release. So after 10 seconds is up, you pull off and make sure you call an ambulance right away. It's also super important that you dispose of the EpiPen right away because it can be unsanitary and you don't want to use it again. It only has one use in it. So people with allergies tend to carry more than one EpiPen on them, but chances are you can only get one shot in their system because if you need to have medical attention right away because this is just a time saver. What an EpiPen does is it releases epinephrine into the bloodstream. So this will help give you some time to call an ambulance, call 911, get medical attention, so that the person can have a little bit more time before their body shuts down. So do not use an EpiPen in replace of calling an ambulance because it's not going to end up saving their life. It's going to extend their life for a little bit, but you really do need to call an ambulance and get them the medical attention that they need. Just to recap, in this video, you learned what anaphylaxis is, what the symptoms are, what common allergens there are, how to use an EpiPen and when to use it. And it's super important that I hope you remember this, so I wrote you guys a song to help you remember it, so here you go.
You ate something that you shouldn't, and he stung by a bee on your knee. You don't know what to do as anaphylactic shock surrounds you. You hope that you have your EpiPen, hoping that your friend can attend to the injury of anaphylactic mystery. Your throat closes, your face swells, you may have blacked out so